Hello, my name is Javier Lopez. I'm a grad student at San Jose State University with a Master's of Social Work program, and today I'll be discussing medical mistrust among Black athletes. So while my focus may be on the experience of Black athletes, I did want to shine a light on the experience of the Black community as a whole, as well as other communities of color. And hopefully with my findings, there can be discussion around bridging the gap between the medical establishment and communities of color. My research began with Kyrie Irving, who's a generational talent in the NBA, the starting point guard for the Brooklyn Nets, and who last year decided would not be getting the COVID-19 vaccine. This was a polarizing decision that people have been for and against. And Kyrie Irving ended up citing previous experiences with recovery from injury and also doing what was best for his own health. So whether we like it or not, Kyrie Irving's decision was him exercising his right to bodily autonomy, which is a right that all humans have. He did lead me to what is essentially my research question. Why might Black athletes be distrusting of the medical establishment? I decided to focus on two reasons: the history of unethical treatment and experimentation, as well as the implicit bias in healthcare settings that exist to this day. In order to examine the historical context, I decided to highlight these three cases. Henrietta Lacks was a woman that was diagnosed with cervical cancer who had her cell line removed without her knowledge or even her permission. The cell line, or the immortal HeLa cells as they became to be known, were then used on countless research over the following 60 years and generated millions of dollars in revenue, which never went to the Lacks family. In fact, the Lacks family wasn't aware of the existence of her cells until 1975, more than 20 years after the passing of Henrietta Lacks. There's also the experience of Ebcade, who was being treated at the Oak Ridge Army Hospital back in 1945 for injuries sustained in a car accident. He was involuntarily signed up for a plutonium experiment where he was exposed to 4.7 micrograms inside of his body. The goal of the experiment was to see what the effects of prolonged exposure would be, and he wasn't actually treated for the primary reason of him even going to the hospital until 3 weeks after, which included a broken arm and a broken leg. And of course, there's the Tuskegee syphilis experiment that resulted in 399 Black men going more than 40 years untreated with untreated syphilis in their bodies. Now, one thing to discuss with implicit bias is that this is all based on the history that we just spoke about. In 2015, there was two studies that I wanted to highlight. One that revealed that NCAA professionals still believe that Black athletes experience less pain than their white counterparts, and one that highlighted a sample of 419 medical school students, that approximately about half of those students still believe that Black patients and white patients are biologically different in some way, shape, or form. So how do we combat implicit bias? One way to do so is by becoming our own advocates. Ways we can advocate for our own health include acknowledging when medical bias is taking place. We must ask ourselves if medical providers truly do have what's best for us in mind, if they're listening to our needs. We must be able to use the channels available to us. There's nothing wrong with filing complaints when we feel those needs haven't been met, and changing physicians and getting second opinions. Again, a part of bodily autonomy, which is a right all of us have. Using a social work framework, the transcultural perspective can be used in health and medicine to help reduce implicit bias as well. It calls for cultural knowledge from professionals as well as cultural competence, an awareness of power and privilege and oppression that people may experience. It calls for our own positionality and being reflective of our place in the world. And of course, it asks for us to be in respectful partnership with others. Here I have my works cited page. And for a more in-depth look at my work and any of the findings, I have created an educational toolkit. You're more than welcome to use the QR code. Thank you very much. And that is my presentation.